Hi, welcome to Quake Clinic. How are you today? Good. Okay. Well, I think we're here for some neurological and muscle control testing, right? A little bit of a follow-up. Okay, great. I have your chart here, and I was just looking it over to make sure, I'm up to date with where we're at. And the first thing I want to do is just put on some gloves, and I'm going to take a listen to your heart, feel a little bit around your throat and face. I'm just going to be checking for any signs of illness. How have you been feeling lately? Okay. Have you been feeling feverish at all? Had a cough? Sneezing? Have you had any trouble swallowing? Okay. And how about your breathing? Have you been having any troubles breathing or feeling like you can't get a deep breath, shallow breathing, feeling dizzy, faint? Okay. Okay, I'm just going to feel here around your neck. I'm just going to apply a little bit of pressure. Sorry about that. Okay, just whenever you can, if you can swallow. No pressure, no rush. Any discomfort? Okay. I'm just gonna press both of my fingertips right behind your ears, and I'm gonna apply some pressure on both sides. Can you just tell me if that feels okay, if either side hurts or makes any area of your face feel any pain or tenderness? Okay. 1, 2, 3. How'd that feel? Okay. All right, good. Let me just make a quick note of that. Okay. All right. And I'm just gonna feel a little bit around your scalp. I'm gonna be pressing my fingers into a couple points along your head, and just let me know if any of those feel tender. Very similar to what we just did with your ears, okay? Okay. So what about right here by your hairline? Does this hurt when I press right here? Okay. And right here at your temples, does this hurt? Okay. And now I'm going to reach over your head and feel towards the back along the sort of ridge at the base of your scalp, okay? How does this feel? Okay. All along here. Okay. And does that pressure feel about equal? Okay, good. Do you have a headache currently? Okay. Do you frequently get headaches? Have you ever had a migraine? Okay. All right. So I'm not seeing any major fluid retention or anything in your face, any puffiness or swelling that concerns me or makes me think you might have any sort of colds. But another great way to get a little more information is to listen to your lungs. I'm also going to listen to your heartbeat. Okay. And do you have any questions about this? It's going to be pretty standard. You can just relax until I give you any sort of direction. You don't have to do anything special. And I'll try to cool down the end of the stethoscope a little bit, or warm it up, I should say, to keep it from being too cold. But I am going to be placing this over your shirt here. Okay, so it shouldn't be too bad anyway. How are you feeling right now in terms of like anxiety? Are you feeling anxious at all? Okay, all right. So let's just take a listen. Okay, I'm gonna move the stethoscope. Heartbeat sounds nice and strong. Okay, I'm going to place the stethoscope on your back now and listen to your lungs. Okay, and can you take a nice deep breath for me in and out? Good. I'm going to move it. Let's do that again. Breathe in for me and out. Okay, I'm going to move the stethoscope one more time on the other side here. And can you cough for me, please? Good, okay, thank you. All right. Do you smoke recreationally or cigarettes or any substances whatsoever? And what about past use? Okay. I don't think that I heard anything in your lungs that would indicate any sort of cold. There's a little bit of raspiness, but I don't think that that's anything outside of the usual sort of parameters. I don't think it's impacting your health. Sometimes people just have a little bit of scratchiness, either from a previous illness or due to smoking, if that applies, or some other allergen, pet dander, pollen, and I think that your lungs sound about in that sort of normal range, if that makes sense. Yeah. Okay. All right. Can I have you open your mouth for me and just say, ah? Good. Okay, tilt your head backward for me. Good. And can you scrunch your eyes nice and tight for me? Good. Open them real wide. Good. Okay. Everything looks pretty good. I don't have any reason at this point to feel like you are ill or have any signs of an impending illness, and the reason why I was checking for that is just to make sure that the results of our tests today are not skewed. Oftentimes when people are ill, it can make them a little sluggish, emotional, just a little less rational or quick thinking than usual. And that can happen even in the days preceding any signs and symptoms of the illness. So we just like to be very thorough and make sure that we're not going to falsely diagnose you with any issues. Okay, good. Thanks for being patient. Just going to make one last note here saying that we went through all of that and just my findings to say that you're clear to move forward with the exam. And then we can move into the exam itself. So do you have a rough idea of what we're doing today? Okay. You may have done some of these tests in prior exams that you've been through, either at Quake Clinic or just any other time that you've visited the doctor for any of these issues. Nothing's really gonna probably surprise you that much, but it's just sort of going to be a sequence of small activities to test your motor skills, your current level of judgment and reflexes, just making sure that your mental cognition is where it should be, also comparable to any past exams. Make sure that there haven't been any issues that have cropped up that we haven't noticed. And it's good just to every once in a while have an exam like this, because some diseases, illnesses, other unfortunate things that can befall us as humans can be really sneaky and not be as, I guess, apparent to us as certain other illnesses, but they can still be very harmful to you, and we just want to make sure that you're not lined up for any problems in the future. We want to maintain our best preventative care. So this is sort of just a follow-up in that way, especially since your previous cranial nerve examinations and all of the results that we've had following your prior injury and just your health along the years, okay? All right, sounds good. Well, now we will work on some sensations. So what I'm going to be doing right now is just pressing my fingers on different areas of your face and just asking you a few simple questions, okay? All right, so I'm just going to be using the pads of my pointer and middle finger on left and right side, okay? All right, so I'm going to press right here next to your nose and up towards your eyes, this little soft spot here. Could you tell me, does the pressure feel about equal on both sides? Any pain in your eyes when I'm just moving here a little bit? Okay. All right. I'm going to use my thumbs for this next one, right along the outer corner of your eyes. Okay, and does either side feel any different than the other? About equal? Okay, great. I'm going to feel along your jaw now and use my first two fingers to press in. Make tiny circles here. How does that feel? Okay, all right. No pain in either side? No, okay. Good, I'm glad. All right, I'm going to use my thumbs again to get a little more pressure, and I'm going to put them along the crest of your forehead, okay? This is a pretty common spot for some people to get tension headaches and other stress-induced headaches. So I'm going to be tender with the pressure at first. Can you tell me, how does this feel? Okay, I'm going to push a little harder. Any pain? How about now? No? Okay. And am I pressing harder on your left or right side? Left, okay, good. Great. How does your head feel right now? Have I agitated anything? Still feel okay? Okay, good. We want to make sure that we keep it nice and light and loose. I'm definitely not trying to cause any trouble for you or induce any sort of headache. So let's just take a second, roll your shoulders down and back for me. Yep, feel your shoulder blades just rest on your back. Nice light neck. Okay. And just make sure that you're keeping this area between your shoulders and your earlobes sort of relaxed and extended. Good. Okay. We'll try to remember that throughout. All right. So I'm going to now swipe a finger on either side of your face, from your forehead down to your chin. Anywhere is fair game, and I'd just like for you to tell me if I've touched you on the left or the right side of your face. So this is your left side, this is your right side. Yes, yours. Perfect. And I'm going to ask you, if you don't mind, please close your eyes for this exam. That's okay? All right. Great. So I'm just going to use my pointer finger pads of my fingers. It should be a nice light skin to skin feel. Okay? So you just tell me left or right. Okay. Left. Good. Right. Right. Good. Left. Right. Left. Left. Right. One more. Right. Great. You can open your eyes if you'd like. You did great. Okay. Next thing I'm going to have you do is I'm going to put my fingers up. We'll start with just one at a time. And I'm going to have you touch your finger, your left pointer finger, to my right pointer finger, this one here, just wherever I move it, okay? All right, so touch, touch, good, 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 great, up here, good, out here, okay, down here, good, and over here, excellent. Let's do the same thing on the other side, okay? So your right pointer, touch, good, over here, down here, touch, up here, touch, good, okay? Next thing I'm going to do is with both fingers, okay? So I'm going to move both at the same time, and they'll move in whatever direction. I just want you to touch the corresponding finger, so don't cross, okay, your body. I want you to keep your left on this side and your right on this side, and just touch my finger pads again, okay? All right, so we'll start here and here. Touch, out, in, up, down, middle again. Great, great job. Coordination is looking great so far. Okay, now we're going to do something similar, but I just want you to tell me if it's on your left side or right side. So I'm just going to hold up a finger really quick, and you just tell me left or right. Easy? Okay, good deal. Right, left, good. Right, right, left, good, good, good. Okay, I'm gonna come closer. closer. Good, okay. Alright, we're going to do that again. This time, focus on keeping your eyes on my eyes and just see the finger out of your peripheral vision, okay? Good. Alright, look in my eyes, please. Right, left, left. Good. Good. Okay, great job. Okay, now I'm going to have you hold your fingers up. You don't have to do it yet, but when we're ready. And I'm going to touch my fingers, okay? I'm going to select different fingers. And we'll do 1, 2, 3, 4, okay? So if I say 1, we're going to do our pointer finger to our thumb. 4 is going to be our pinky. So we have 1, 2, 3, and 4. Okay? And you're just going to do the same thing that I do. We'll start off nice and slow, okay? Okay. So, just to establish, we have 1. Good. Yep, just do it with me. 2, 3, 4. 4, 3, 2, 1. Good. 1, 3, 4, 2, 1, 3, 2, 1, 4. Good, you're doing great. This is making sense. Can I speed up a little? Okay. 1, 3, 4, 1, 2, 3, 4, 2, 1, 4, 3, 4, 2, 1, 4, 3, 2, 1. Great job. Okay. Now I'm going to hold mine up, okay? And whichever finger I call out is the one I'd like for you to touch my fingers with, okay? Okay, so I'm going to come close for this. I'm going to hold my fingers static. This is not to test whether or not you can meet my finger. This is purely to test you remembering which finger pad to select, okay? Great. So here are my fingers. I have left and right. Okay, 1, 4, 2, good, 3, 4, 1, 2, 4, and 1. Great. Okay. All right, I'll give your arms a rest now. And instead, I'm just going to test some of your muscle control so you can relax. Remember to keep your neck and shoulders long and nice and calm, soft. Good. Okay. So now I'm just going to come a little close and test some of your muscle tone. Okay. So can you please turn your head into my hand here? Good. Other side. Good. Okay. Push your head into my hand, your forehead. Yep. Good. And I'm going to cup your chin here. Just push forward. Yep. Not too hard. Good. Okay. Excellent. I'm going to push in on your jaw a little bit. Other side. Okay. I'm going to hold the heel of my palm to the side of your head, and I'd like for you to just push to the side, please. Good. Other side. Excellent. Okay, you can just loosen up. Good. All right. I'm going to put my hands on your shoulders now. Can you shrug for me, please? Good. I'm just going to push down here. All right. I'm going to hold your shoulders on either side. Can you twist your body for me? Good. Okay. Excellent. Now, if I can just have you put your arms like this for me, and I'm going to hold onto your elbow, and I'm going to have you push up and then down onto my arm, okay? Here we go. Push up. Good. And down. Great. Okay. It's looking really, really good. Okay. Just look through here. See what other tests have been prescribed. Okay. Have you been having any allergy symptoms lately? Okay. How's your skin been doing? Okay. How's your rash? Have you had another rash since the last one? Has that completely dissipated? Yes, okay. And what caused that, do you think? You're sick? Oh, okay. I see. And did you take an antibiotic for that? Okay. Do you mind if I check and look where it was? Okay. I'm going to put my gloves back on. I don't want to further irritate the area, especially if you're just getting over it. Okay. Now I've got my gloves back on. I'm just going to take a look, okay? You said it was around your ears. Okay. Okay, yeah, I see that. Just a little bit of redness. It's kind of almost pink now, I guess. Yep, okay. And it looks like it went around your hairline a little bit and across your neck. Oh, it was all the way down your back too? Wow, okay. Was it on the opposite side? You mind if I take a look? Okay. Okay, yeah. I see that. A little bit of a scarring here. Did you scratch it a little? I see. Okay. Okay. And how is it looking on your chest and back now? It's cleared up all the way? Okay. Alright. I'm just going to look around your jawline here too. Can you tilt your head up for me a little? Okay. I can see just a tiny bit of marking here. Okay. All right. Well, if that is continuing to clear up, how long did you say it's been? Okay. That's still in a pretty decent time range, so I'm not very worried about it yet. If it goes on another week, definitely call me, and we'll try to get you some sort of cream or something to make sure that the little bit of inflammation that's left goes away and you don't end up with any sort of scarring. Okay, all right. Have you had any other irregular symptoms or? Okay. 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 I don't think that should impact these results. So that's good at least, but we can definitely get you some follow-up care for those things if necessary, for sure. Okay. Yeah, sometimes it just takes a little while to know for sure, and I feel like a lot of us are quick to jump the gun with worrying that something's going to be a long-term problem, and I completely understand the fear and the response. I think it's very natural, but you're still in a very safe guideline for that kind of issue, so I wouldn't worry yet. Usually you'll know if things are really, really bad, so don't freak yourself out and think that something's worse than it is, because you can definitely make it worse by just putting yourself through that suffering, and amplifying your fears could actually manifest physically in a lot of ways, and we don't want you to be feeling worse than you need to. So staying calm right now is really, really important, I would say, in making something like that go away, or at least be managed a little bit better. Do you have anything that you do right now for relaxation? Okay, good. Okay. Well, I would definitely recommend that you allot a certain amount of time per day towards enjoying something that makes you feel relaxed, whether that is a video or a sound file or an activity or riding your bike or whatever makes you feel that sort of inner calmness and peace. Some people feel it more when they exert themselves and exercise. Other people feel it more when they are still and meditative and maybe exposing themselves to environments that please them. So whatever your juju is, I recommend that you take at least 15 minutes, I would say, every single day to indulge in that. And don't, if you can help it, do that right in a hurried way, I should say. So don't make it like the last thing you do before you go to bed in a rush, or don't count that session of meditation if you fell asleep and it became a nap, or if you're very distracted. That doesn't really fulfill the point of spending the time. The whole purpose is to make yourself feel better and more whole and more calm and able to deal with things that might irritate you or negatively impact you and raise your stress levels. So, for example, a lot of people who like to watch relaxation videos or listen to meditative sound bites will do so as they're falling asleep, which is great for falling asleep, but it can also be helpful to experience these things in a full state of consciousness and really have that positive effect applied while you can process it and really enjoy it. So just be honest with yourself is really the bottom line. It's for your own benefit, obviously, so however you choose to make that happen, no one is going to judge you for that. Certainly not me. Okay. All right. Make another note here. All right, we're just gonna do a couple more motor function tests, if that's okay with you. Great. So the first thing I'm gonna do is I have a little bit of a wacky pen here. Can you tell me what color this little ball is on the top, the little stylus? Good, that's purple. Excellent. Can I just have you look at that purple point? Good, and now look at my nose. Look at the purple point again. Good. And look at my nose. Purple. Good, back to my nose. Stay on my nose, good. And the purple point. Good, okay, look at my finger over here. Can you still see that purple point out of your peripheral vision? Okay, same on the other side. Look at my finger here. Keep looking at it. Can you see the purple point in your peripheral vision? Okay, good. All right, now I'm just gonna come closer. We're gonna do something similar. Okay, look at my finger here, please. Just let me know when you can see the purple point. Okay. 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 Good. Other side, please. Stare at my finger here. Good. Okay. Okay. Good. Good. Okay. Excellent. Okay. Next, what I'd like for you to do is I'm going to have you close your eyes. You don't have to scrunch them tight or anything, and you can wait until I finish explaining if you'd like, or you can keep them closed. Okay, so what I'm going to do is put up some numbers. We're going to start with one hand, okay? And I'm going to have you first tell me, is this on the left or the right side? And then I'm going to flash a series of numbers, and you just tell me what those numbers are. Okay, great. So please close your eyes and open. Is this hand on the left or right side? Right, good. How many fingers? 2. How many? Good. 5. 3. Good. Okay, great job. Close your eyes for me again. Okay. And tell me, open now. Is this on the left or the right side? Left. Excellent. How many fingers? 1, 2, 3. Good. Okay. Good. All right. Next, what I'm going to do is have you close your eyes again. When you open, I'm going to use both hands, and if you can tell me the total, okay? So if I had hold up my fingers like this, that's 3 total fingers, okay? So you don't have to separate, I want you to add. Okay, great. Close your eyes, please, and open. 4. Good. 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 Okay. Good. Okay. Good. Great. Okay. Excellent job. We have one more in this number series, okay? Alright, so this one's going to be a little bit different. I'm going to have you open and close your eyes over and over, okay? Each time you open your eyes, I'm going to be holding up a different amount of fingers, and you just tell me how many fingers, okay? So we'll just do one hand for now. Alright, I'm going to come in a little closer, and close your eyes, please. Open, close, open, close, open, good, open, close, open, close, open, close, open, good, close, open, close, open, close, good, open, and close, good. All right, how are you feeling? Good. Well, you're doing a great job, so I hope you feel relaxed. Shoulders away from your ears. Good, okay. All right, we just have one more toast. I know. Well, it should be a good one. So I am going to have you close your eyes again, and we're going to do an open close, but I'd like for you to just tell me right or left. So I'm only going to use one finger, my pointer finger on either side, and I just want you to tell me left or right, okay? I'm going to start further away and progressively get closer. Okay. All right. Close your eyes for me, please. Open, left, good, close. Open, right, good, close. All right, I'm just going to have you open and close now every time you tell me left or right so that we can move a little faster. Okay? So once you answer, you can feel free to close your eyes. Okay. Left, good, open, right, good, open, right, good, open, left, good, 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 right, open, right, open, right, good, left, excellent, left, good, and open, left, good, left, good, center, good, right, good, center, good, left, good, right, good, open, left, okay, right, 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 great job. Okay, I'm really happy with how everything went. I think you seem in excellent condition. Your reflexes and memory retention and motor coordination are all looking just like they should. Okay. All right. Well, did you have any other questions for me? Yeah, we can get you a copy of all of the findings from today. It will describe all of the tests that we did and their various purposes, and you can see how you did, just if you're interested. Okay, great. Well, it was a pleasure to see you again, and I hope that you're feeling good. You look great. I'm very happy to see all of your progress and be able to check in with you again. I feel like it's been a while since we've seen each other, so this was really nice. Great. All right, well, as always, you're welcome to stay here and nap and enjoy the use of our facilities at Quake. Take your time getting back out there if you'd like. Okay. All right, well, I'll see you next time.